So, tenderness and the swelling is the most important clinical feature. Next one is a deformity. This is usually seen in the displaced fractures and dislocations. Undisplaced fracture, that is mild strain and sprain, usually show the no deformities, and some of the deformities are very characteristic and specific and help in making a spot diagnosis. Abnormal mobility between the fracture fragment is the sure sign of a fracture. So, abnormal mobility is a definite and sure sign of the fracture. And in the deformity, it is usually seen in the displaced fracture and dislocation. So, when there is a displaced fracture and dislocation is occur, the deformity is surely present. In undisplaced fracture, mild strain, sprain usually shows no deformity. Remember that undisplaced fracture, and when there is a mild strain or the sprain, then there is a no deformity. And some of the deformities are very characteristic and specific and help in making a spot diagnosis. So, deformities is also important clinical feature of the fracture. So, some important deformities in orthopedic, that is diagram A shows a dinner fork deformity. In that we can see how this is a dinner fork deformity is occurred. Then Schwann neck deformity. That is, this is like a Schwann neck, so it is called as the Schwann neck deformity. That is the diagram B. In the diagram C, we can see that anterior dislocation of the hip here. And in the diagram D, we can see a posterior dislocation of the. So these are the some important deformities in orthopedic, like dinner fork deformity, Schwann neck deformity, anterior dislocation of the hip, and the posterior dislocation of the. Nextly, we can see that deformity fact, that classical deformity and its possible diagnosis. So, when we see a brain neck, there is a cervical spine injury, and in grouping of the shoulder, we shows a clavicle fracture. A flat shoulder shows anterior dislocation of the shoulder. A S-shaped deformity of the humerus gives the supracondylar fracture. Dinner fork deformity seen in the Colles fracture, that is this. So it is seen in the Colles fracture, that is dinner fork deformity. Then Boutonniere deformity is seen in the rupture of central extensor slip of finger. Mallet finger is seen in the rupture of distal end of the index extensor. Then Jersey finger, which is seen in the rupture of the distal end of flexor digitorum profundus of index finger. Then flexion, adduction and the internal rotation is seen in the posterior dislocation of the hip. Flexion, abduction and external rotation of lower limb is seen in the anterior dislocation of the hip. That we can see in this diagram, that is anterior dislocation of the hip. So in that we can see a flexion, abduction and external rotation of the lower limb. And in the posterior dislocation of the hip, in that we can see the flexion, adduction and the internal rotation of the hip. Then incomplete external of lower limb capsular shows the fractured neck femur. Then Complete external rotation of lower limb shows a trochanteric fracture, shaft of the femur fracture, and leg bone fracture. H-shaped ankle shows ankle dislocation. Loss of transmitted movement, where one end of the limb is rotated automatically, is transmitted to the other end, and due to the break in the continuity, this is no longer possible in displaced fracture. So, when loss of transmitted movement, when the movement is when there is a loss of transmitted movement, when one end of the limb is rotated and automatically is transmitted to the other end. But due to the break in the continuity, there is a no longer possible in the displaced fracture. Next is the crepitus. Crepitus is an abnormal grating sensation produced by the friction between the two ridge surface of the fracture fragment. Obviously, it is elicitable only in the displaced fracture, and it should be elicited very gently and at the end of the clinical examination. Then, shortening of the limb. Limb shortening of a various degree is common in bone and the joint injury. So, when there is a bone or the joint injury, limb shortening is seen common. Then, a crepitus, that is an abnormal grating sensation produced by a friction between the two ridge surfaces of fracture fragment. So, note the crepitus abnormal mobility, deformity, and loss of transmitted movement cannot be elicited in an undisplaced fracture, stretched fracture, impacted fracture, etc. So remember that clinical manifestation in a fracture are due to the fracture per se, its complication, or the bone. So note that crepitus, abnormal mobility, deformity, and loss of transmitted movement cannot be elicited in undisplaced fracture, stress fracture, and the impacted fracture. Next one is tenderness. So remember that tenderness may be the only evidence of the fracture in crack fracture, hairline fracture, stress fracture, fatigue fracture, torsus fracture, and the pathological fracture. And method of eliciting proceed from normal area to the affected part for better patient compliance. So grade 1 is just a suspect. Grade 2, that patient winces on pressure. Grade 3 is that patient winces and withdraw. And grade 4, that patient will not allow to touch. So these are the grading of method of eliciting the proceed from normal area to the affected part. That grade 4 fracture is the more painful, that patient will not allow to touch. So it is very much tender. Grade 3, at the patient winces and withdraw. Grade 2, that patient winces on pressure, and grade 1, that is just a suspect. So this grading of tenderness is superior to the conventional mild, moderate, and the severe grade. Next is the crepitus. So crepitus is defined as an abnormal grating sensation either felt or heard That is, fine crepitus is seen in osteoarthritis of a knee, that is OA of knee. Then coarse crepitus is seen mainly in the fractures, and snap crepitus is seen in the snapping tendons. So remember, it is unkind to elicit a crepitus in a fracture for fear of hurting the patient. So these are the crepitus. So crepitus is the abnormal grating sensation either felt or heard. It is felt by hand when we examine the patient, and it is heard by ear. That is when there is a fine crepitus. It is seen mostly in the OA case of a knee, that is osteoarthritis. Then coarse crepitus is mostly seen in the fractures. Snap crepitus, that is seen in the snapping tendons. Then deformity. Deformity is defined as a deviation of the normal anatomy of bone or joint. So when there is a deviation of normal anatomy of a bone or joint, then it is called as a deformity. So remember, D in fracture, that is deformity is seen often in displaced fracture. Then displacement could be anterior, posterior, medial or lateral. Then a distal fragment is the reference point to suggest the type of displacement, and dislocation of joint usually present the deformity. So remember the 4D in the case of the fracture. That deformity is seen often in displaced fracture, and displacement could be anterior, posterior, medial or lateral, and distal fragment is the reference point to suggest the type of displacement, and dislocation of joint usually present a deformity. So next point is an interesting feature about the clinical signs. So various clinical signs are described in the fracture. They can be best represented as follows in order of their importance. Then clinical manifestation due to the neurovascular injuries. Certain fractures are known to cause a neurovascular damage quite frequently. For example, supracondylar fracture of the humerus in the children. The familiar 5PC PS detects depending vascular damage, and the nerve injuries are detected by classical deformities and the screening test as described in the peripheral nerve injury. So relevance of clinical signs are unfailing signs. Firstly, that is abnormal mobility and crepitus. Reliable signs are tenderness and shortening. Important signs are bruise and swelling. Other signs are loss of function and deformity. Late or inconstant signs are blister, ecchymosis, and the swelling due to the gas. So, interesting feature of clinical sign in that various clinical signs are described in fracture that may be best represented in the follows in order of their importance. So, according to their importance, the clinical sign is present. So, clinical manifestation due to the neurovascular injury. When there is a neurovascular injury, the clinical manifestation is seen. Certain fracture are known to cause neurovascular damage quite frequently. And supracondylar fracture of the humerus in children, it is the example of this neurovascular damage fracture. So, relevance of clinical signs is that unfailing signs are abnormal mobility and crepitus. Reliable signs are tenderness and shortness. Important signs are bruise and swelling. Other signs are loss of function and deformity, and the late or inconstant signs are blister, ecchymosis, and swelling due to the gas. So, about the 5 Ps. In detecting impending Vascular damage in musculoskeletal trauma, there is a pain, pallor, paresthesia, pulselessness, and paralysis. So these 5P is very important in detecting the impending vascular damage in musculoskeletal trauma. So, in that case, there is a pain, pallor, paresthesia, pulselessness, and paralysis shows the very important points. So, remember that pain, pallor, paresthesia, pulselessness, and paralysis. So, these are the 5 points are very important in detecting impending vascular damage. So, in the next lecture, we will discuss about the missing fact in the fracture and the further topic of the general principle of the fracture. Till that, have a good day and we can stop here.